As you are preparing or revisiting your Ending the HIV Epidemic plan to prioritize rural communities, the first question you may be faced with is, what does rural even mean? If you were to ask 100 different people to define what is rural, you could easily get 100 different answers. Even the federal government has multiple ways of determining what is rural. One example is the US Census Bureau's definition. They define rural as what is not urban. That is, after defining individual urban areas, which includes areas of 50,000 or more people, and clusters of at least 2,500 people, rural encompasses all population, housing, and territory not included within an urban area. At the time of the 2010 census, almost 60 million people, about 19% of the population, lived in rural areas of the United States. However, most real people don't pay attention to their designation based on census data or any other official definition. People may have personal definitions that don't align with any official numbers to describe why they think of themselves as living in a rural area. So while we'll provide some statistics in this video relating to the census definition of rural, some of our suggestions for best practices may be applicable to communities that aren't technically rural by this definition, but are generally smaller areas outside of city centers that may consider themselves rural. According to a Pew Research Center analysis of census data, rural counties have lagged in population growth, and half of them have fewer residents now than they did in the year 2000. However, there are some geographical differences. Among rural counties, a majority in the Northeast and Midwest lost population since 2000, while a majority in the South, and especially the West, gained population. Additionally, as a group, rural counties skew older than suburban and urban counties, and about a third have concentrated poverty, compared with 19% of cities and 15% of suburbs. Communities facing shrinking populations experience reduced access to essential services like schools, healthcare, and grocery stores, because it can be difficult to recruit workers or can become too expensive to keep these services open. In general, people living with, impacted by, and affected by HIV in rural areas face challenges in accessing consistent HIV prevention and treatment services due to lack of public transportation, longer travel time to receive care, and widespread shortages of medical and social service providers. Let's talk about a few things to consider if you are prioritizing engagement with rural communities. Perception within and about rural communities is important to understand. If your agency staff are coming from urban and suburban areas, it's possible that folks may have some amount of rural prejudice, considering the dominant urban culture often portrays rural people in negative stereotypes. Additionally, 2/3 of rural residents report feeling that people who don't live in the same type of community don't understand the types of problems faced by those who do. So people from rural areas may be inherently skeptical of people coming in from other areas. Whenever possible, partner with existing community-based organizations, faith-based institutions, or other local agencies that have already built relationships in the area. Speaking further to the spirit of partnership and collaboration, sometimes the best way to get the work done is to let another organization take the lead. And to go a step further, ask your partner organizations how you can best support them throughout the duration of the project. Organizations and agencies working in rural areas are often spread really thin. Don't assume that your partners can adhere to the same time commitments and expectations as people in more urban areas. Another consideration to make is how much time and financial resources you want to put into engaging rural communities. Even if much of the work can be done remotely, it means a lot to rural folks if you can make the trip to visit them in person, especially for occasional casual meetings and not only for official site visits. You should budget for mileage reimbursement for these kinds of visits, or may want to invest in a vehicle if you'll be doing frequent visits or direct service in rural areas. And when remote meetings are necessary, check in with folks to find out what the best form of communication would be. While video chats can be nice to see people face to face, some rural areas aren't blessed with high-speed internet, and a phone call, email, or even postal mail may be a better option for some communications. Finally, demonstrating your long-term commitment to working with rural communities may include hiring or working with community health workers and becoming involved in your local state rural health association. As a respected institution in your community, you have the ability to advocate for rural health in your area and to help educate others about how best to work with these communities. When working with migrant populations, there will be specific considerations depending on the ethnic and cultural backgrounds and immigration experiences specific to your jurisdiction. But in this video, we'll provide some broad recommendations to get you started in planning community engagement with migrant populations in rural communities. One of the first things to consider is how recently someone may have arrived in the community and how stable their living condition is. Additionally, migrant communities often have a higher percentage of folks with major health concerns who live below the poverty level and who have a lower level of formal education. More than 1 million immigrants have moved to rural U.S. counties since 1990, and the movement of foreign-born adult residents to a community can be prosperous for the area due to more contributions to schools and roads and a larger customer base to keep retail stores and other services in business. Additionally, immigrants and refugees who are often resettled in rural areas do jobs that are essential for the survival of a number of key industries. While immigrants in rural communities are typically associated with agriculture, the rural United States is not a monolith, and immigrants own their own businesses and work in food processing, manufacturing, and tourism. Unfortunately, rural communities on the whole are uniquely disadvantaged in dealing with such population change. Small communities have limited resources to cope with population influx on their infrastructure and needed services, and they tend to be less prepared to deal with cultural change compared to large cities that have had more experience integrating new immigrants. Real challenges and potential for conflict exist in rural areas because even a small numerical change in population may seem overwhelming. Language barriers may create significant difficulties in communicating with these folks, and not all communities are equipped with the resources to provide universal translation services or English as a second language instruction. If your agency is working to engage a specific migrant population, you should strive to bring on team members who speak the same language and regional dialect and who may have similar background experiences. Above all, it's important to remember that the US is currently very divided on issues of immigration, and many people feel unsafe to identify themselves as an immigrant. It's not unheard of for Border Patrol to position themselves near healthcare facilities or use other intimidation tactics that cause people to think twice before engaging with public agencies such as health departments. This underlies the importance of taking yourself to their community rather than expecting them to come to you. Additionally, policies relating to integrating immigrants are developed at the local level, meaning attitudes toward immigrants and available services can vary widely between jurisdictions, and each specific community you are looking to engage will have unique concerns and considerations. In summary, working to engage migrant communities in rural areas may present several initial challenges, but your persistence can create a strong foundation for engagement and service delivery in the long run. Get to know the unique characteristics of the community and the people who reside there. Build relationships with partnering organizations and gatekeeper individuals who can facilitate introductions, and always compensate people for their time.